Imagine England lose tomorrow. Would anybody say the players just need more willpower? Of course not. We would ask, were the tactics right? Was the strategy right? Did the coach get it wrong? The manager would not blame the players. He would study the game, analyze what's working, what is not working, and change the plan. Yet, when somebody struggles with obesity, we often assume they are not trying hard enough, not disciplined enough, not motivated enough, and rarely ask whether the strategy, the support, or the system has failed them. Most obesity care still uses the blame model. Football uses the performance model, and the performance model is far more useful. I am Dr. Almerie, consultant weight loss surgeon, and on this channel, my goal is simple: to help people living with obesity understand what's happening inside their body, navigate the challenges they face, and make sense of the treatments available to them so they can make better decisions for their health with clarity, confidence, and less shame. Today, I want to explore a fascinating question. What would a football manager do if they were put in charge of obesity care? And what does that teach us about everything we get wrong about obesity? Because once you see it, you may never look at obesity treatment the same way again. Let's explore that. A football manager would build a team. Think about the best footballers in the world. Do they succeed on their own? Of course not. Behind every player is an entire team. Coaches, nutritionists, physios, doctors, performance analysts. Nobody expects a footballer to perform at the highest level without support. Yet, many people living with obesity are expected to lose 50 pounds, 80 pounds, 100 pounds, sometimes even more, and they are expected to do it almost entirely on their own. No coach, no nutritionist, no psychologist, no support system, and often no structured plan. And if they fail, we often blame them. But imagine a football manager saying, "I have given the player the ball, the rest is up to him." It sounds ridiculous because success is not a solo sport. Success is a team sport, and that is the first lesson football teaches us about obesity. A football manager would create systems. Think about an elite football team. Do managers walk in every morning and ask, what do you feel like doing today? Of course not. Everything is structured. Training plans, recovery plans, meal plans, practice schedules, performance reviews. The players do not just wake up every morning and negotiate with their motivation. The system decides what happens next. And that matters because most people believe weight loss is a motivation problem. But football managers know something different. Motivation comes, motivation goes. Some days you feel unstoppable. Some days you do not want to train at all. That is normal. The best teams do not rely on motivation. They rely on systems. Systems that work on good days. Systems that work on bad days. Systems that keep moving people forward even when motivation disappears. Yet, many people with obesity are told to stay motivated, to try harder, to be more disciplined, with no clear systems to rely on when motivation dips. And it will dip. And that's the second lesson football teaches us about obesity. The people who succeed most are not always the most motivated. They are often the people with the best systems. A football manager would track the right things. And here is where obesity care makes one of its biggest mistakes. We stare at the scale like it tells the whole story. It doesn't. A football manager would not spend all week obsessing over the scoreboard. He knows the scoreboard is only the final results. What he really wants to understand and track is what creates the results. He wants to know, are we creating more chances? Are we controlling the game better? Are we improving? Because performance often improves before the scoreboard changes, and obesity is no different. A football manager would not just want to know your weight. He would want to track what is driving your health and performance. Are you losing fat? Are you protecting muscle? Are you getting fitter? Is your waist to height ratio improving? Is your exercise tolerance improving? Are you eating enough protein? Are you sleeping well enough? Because these are the things that create the results on the scale. In fact, these changes often create more sustainable results than simply chasing a number on the scale. And that is the third lesson football teaches us about obesity. Do not become obsessed with the score. Track the things that create the score, and the score will take care of itself. A football manager would adapt a strategy, and this is where many people lose hope. Not because they failed, but because they kept using the wrong strategy for the wrong body. Every football fan has seen it. A player struggles. The fans criticize him. The media criticize him. People start asking, is he good enough? Then he moves clubs, gets a new coach, a new system, a new approach, and suddenly everything changes. Same player, different coaching. When a player is struggling, the answer is not always try harder. Sometimes the support is wrong. Sometimes the coaching is wrong. And obesity is no different. Many people spend years trying the same approach. Diet, diet, diet. And when it fails, they blame themselves. But a football manager would ask a different question. Is this the right strategy for this person? A football manager would not use exactly the same plan for Mohamed Salah, Cristiano Ronaldo, Erling Haaland, and Lionel Messi. These players have different strengths, different abilities, different stages of their careers. A great manager understands this. He will build the strategy around the player, not the player around the strategy. And obesity is no different. Different people have different needs, different challenges, different biologies, and different solutions. Some people need a different diet. Some need more support and coaching. Some need medications. Some even need surgery. And some need a combination of these tools. The goal is not to find one plan for everybody. The goal is to find the right plan for the right person. And that is the fourth lesson football teaches us about obesity. Sometimes the problem is not the player. It is the strategy. So what would happen if a football manager was put in charge of obesity treatment? He would not start by blaming the player. He would build a team. He would create systems. He would track the right things. And when something was not working, he would change the strategy. Now, of course, this does not mean the player has no responsibility. A football manager can create the perfect plan, but the player still has to train, still has to learn, still has to show up, still has to perform. Success requires both the player and the system. But football also teaches us something else. Even the most talented player will struggle with poor coaching, poor support, poor tactics, and obesity is no different. Perhaps the biggest lesson football teaches us is this: when a footballer struggles, we look for solutions, not someone to blame. That is the difference between the blame model and the performance model. And maybe it's time we use the right model for obesity treatment too. I am Dr. Almerie. Thank you for watching, and I will see you in the next video. Stay informed, stay healthy.